welcome.
You're good.
And then are you going to explain how people can access that?
Well, it's live now, so
Okay.
yeah.
Okay.
Yeah, go ahead.
Well, good morning. It's good to have everybody here. This is Carol Mccrery from Strom Center, and she's going to be talking about Medicare and the changes and the things that we've been talking about this morning as far as concerned. And then Erica Pence, who is here with the health department, but she's recording this, and hopefully later on she'll be able to tell us how we can go on Facebook or YouTube.
Yep.
And you can go back and refer to it as you're working through all of this information that we have. Right. So I think everybody's familiar with housekeeping. There's a restroom over here, restrooms down here. If we should need to leave the building, you can go out the door that you came in, and then there's a door right over here that I would be able to unlock and let you out. And just a couple of things for your information. If you were here yesterday, you probably heard all this. We have the flu shot clinics, and we still have 3 left. Wednesday, October 15th, Wednesday, October 22nd, and Wednesday, October 29th. And there's information over here on the table, all kinds of information for you to take. And then the other thing that I just wanted to mention briefly is that we do have the Henderson County Medical Reserve Corps, and that sounds like we do a lot of stuff with medical issues and concerns. But what we are looking at is trying to have volunteers who are just trained so that in case of an emergency, you would know where to go to sign in, because a number of years ago, and I think Karen can talk to that, Karen Cole can speak to that. The county lost like $3 million in federal money because volunteers were coming to help with the flood of 2008, but they weren't signing in anywhere. And so, used to be, at least for the federal government, you had to have documentation that volunteers had worked the number of hours that you said. So we just want to do some training for people about that. The other thing is, we do have the Henderson County Community Pantry over here in this little room. And so we've been having some volunteers help with that because unfortunately the grant on which Karen Cole worked, that ended. I'm no longer on a grant that I was paid from, but I'm on a couple of other grants. But my hours have had to be cut back. And so we would like to have, as I said, volunteers who know where they should go. So we do have a couple of trainings coming up. One is the 20th of October, and that's on a Monday, and it'll be here from 4 to 6 p.m. And Tessa Curley is going to be coming and doing a team building activity called Real Colors. A lot of fun. And then we'll be meeting again on November 3rd for 2 hours, and we're just going to go over volunteer operations and safety issues and that sort of thing. So if anybody's interested, please see me afterwards, and I'll be glad to talk to you about it. So with that, I'm going to turn it over to Carol, and she's got a lot of information.
Don't be overwhelmed by all the paperwork. I appreciate the opportunity to come and talk to you because there are some changes, and we just want to get the word out. The changes are really large changes, or high cost changes on some issues, and other things I think people are going to be very happy about. I do want to thank Karen and Sharon,
And Erica.
Not Erica, and Erica, because they've all really been instrumental in making sure that we kind of link our services and share information. So that's really, really important. You've got the packet of information, and I will tell you, I'm just going to go over a little bit. quickly, some of the things, if you were here last year, you'll think that this is pretty familiar, this page. But the items on it are really, they are not the same as they were last year. Things have changed. So that Medicare informational meeting, this one is really tailored to Henderson County. So there's issues that are, the situations in Henderson County that are different than Warren County. You wouldn't think so, but there are, just that, just a few miles difference, or a big difference in some of the plans. But I'm gonna concentrate on the ones for Henderson County. The things that aren't gonna change are the Medicaid, well, that are gonna change, that I'm gonna talk about, are the, I'm not gonna go into great detail, because even though I got this on paper, and this is what we were given at a meeting, they said it's not set in stone. Last year, I think I made 1,000 copies of one form that said what all the Medicare premiums, deductibles, and everything, and they changed it on me. So I'm not going to do that this year, but I'm going to just kind of tell you what they said in October that the cost would be for 2026, but again, not set in stone. So Medicare A, this isn't going to affect a lot of people, because a lot of you have Medicare that is no cost to you. And if you have an Advantage plan or Medicare supplement, this isn't something you often see, the Medicare A part. But that deductible, if you have a Medicare supplement or an Advantage plan, this is embedded into it. The deductible for Part A has gone from $1,676 to $1,716. That's not a year. That's a benefit period. So if you go in the hospital, let's say you don't have Medicare, you have Medicare, but you don't have a Medicare supplement or an Advantage plan. You go in the hospital this week, and then within another couple of weeks, you're going again, you've got one deductible. But if there's 60 days between a discharge and a readmission, you got that again. So typically, you could have 4 of those amounts if you didn't have a supplement or Advantage plan. You could have, if you went in the hospital and were admitted. So those are things that are critical for people that don't have a supplement or don't have an Advantage plan. We're going to talk about that in great detail in just a minute. The Medicare B, this probably will hit most of you, and that is, Medicare B is the doctor and outpatient insurance on the red, white, and blue card, the B card. Right now, it's $185 a month for that. That's the amount taken out of your check, probably. If not, you have to pay for quarterly or whatever. But that's going up $21.50 a month, and it'll be about $206.50 a month next year. So that's a pretty steep amount. And then the Medicare deductible, which is the amount that you have to pay if you have a supplement like a G plan. The amount that you have to pay before that plan pays has gone from $257 a month to $288 in 2026. So my husband had some health issues. He had cancer one year, and so he goes for scans every January and does all these things with the doctor. And we know this year that when he paid $257 out of pocket, he could just pretty much fill all those bills and everything in the file, because he knows he's met that. But this next year, he will have to pay $288 before it starts to pay. So that's really, for most Medicare supplements, that's going to be your rule of thumb.
But just the one time, right?
Pardon me, yes, that's
okay.
okay. Thank you for saying that. Yes, that's not like the Part A where you have the benefit periods. This is a year. So, and then the Medicare C out-of-pocket maximums, we don't know yet. We do know that the Part D prescription drug premiums, they're ranging this year, or last year, between $0 and $125.80, and now I think it's $119 is the maximum amount for Mccrery, but we're gonna talk about that too. So what's covered under Part A and B? A is the hospital, strictly the hospital, so if you go in the hospital, also some nursing home care is covered under Part A. Part B is the doctors and other providers, so when you go to the doctor, and then some out of hospitals costs are covered under Part B too. So, but if you remember, the hospital is A, some nursing home care, if it's skilled nursing, that's gonna be under Part A. Okay? Then we've got, and I'm going down the line here, we've got preventative services, and I think that, Sharon, I think are those the pink ones?
Yeah.
Yeah. Lisa color coded everything for me. Can't remember what color though. Let's see, the preventative services are very similar to what they were this current year. So there's a whole host of preventative services. And I don't think people really take advantage of those preventative services. I've had people many times come in and ask me how much it costs. You know, if I went and had this, how much would it cost? And I say, $0. You know, if you had Medicare, it's a preventative service. There is one that I put a little X by, and that's where the colonoscopies are, because they touched on that yesterday at one of our meetings.
Well, wait,
What sheet you on?
what sheet?
Oh,
Okay, it's not the pink sheet.
Okay, not the pink sheet.
Yeah. Is it
All
this?
right. Are the preventative services over there? Oh, they're white.
Oh, okay.
They're white.
Okay.
Okay, it says preventative services on it. Is it showing there?
Are they in the book?
Oh, they're in. That was a test, and you all passed. Okay, I just happened to see if you noticed.
Okay. Oh, she's bringing it. Oh,
All right, so here are the preventative services. They're on a white sheet. And you will see that halfway down, where it has the list of colonoscopy tests, there's a little asterisk. And they did say yesterday at a meeting that there is a more intensive test. I haven't heard, haven't had that defined yet. But those, look at all the preventative services. I mean, it is just, it's unreal the number of preventative services that are provided and that people don't take advantage of. Especially things like colonoscopies, which can be so very, very critical. Mammograms, my daughter does mammograms out of OSF, and she's a big proponent of, mammograms. I mean, she just really sold. Of course she is anyway, she sold on it, but,
And this is Breast Cancer Awareness Month too.
yes.
Yes.
And we actually had a health fair at one of the churches, and so we got to be side by side.
Oh.
Yeah, so she's, and I am too, I'm very sold on too. For anybody that's got breast cancer in their family or not, even if they don't, it doesn't have to be inherited. It could be all of a sudden somebody's, has that diagnosis. You do it or you get it early, and differences are huge.
And also for men, if they have a first relation, like their mother, their grandmother, a sibling, if they've had breast cancer, that increases the man's chance of having prostate cancer too.
Thanks for bringing that up.
Yes.
Thank you. Yep. Mhm.
And men can get breast cancer too.
Yep, sure can. Okay, so, those preventative services, make sure you check those out, especially the colonoscopies and especially the mammograms and a whole host of other things too. Go through that list, and, and for most of them, it's yearly. I know the colonoscopies, a lot of times they'll say after the age of either 70 or 75, they kind of say maybe the people tests might work, just as an indicator, because the lining of the colon is a little bit thinner, so colonoscopies aren't as requested by the doctors, but still in all, they may be. that's up between you and your doctor. The preventative services may be covered, but not after preventatives, but not the after preventative. Here's what I want to mention, because this is something that was a big deal when somebody came into my office just about a month ago. The preventative service is covered, the colonoscopy, the breast exams, a whole host. What isn't covered is the after results. So it may be covered by your supplement, or it may be covered by your Medicare Advantage plan, or original Medicare to some degree. But I know we've had a situation where someone was on the Aetna plan, and it's an Advantage plan, and they wanted to go to Mayo's, and they came in very happy because Mayo said yes, that they would provide that preventative service, even though they usually don't take the Advantage plans. But I did caution her that if they found something, that's a different story. It's not covered. It would be covered by your supplement or your Advantage plan. So if you find breast cancer, or if you find colon cancer, or some of those other challenging situations, the test is covered, but the care afterwards, if something's found, that goes to your Medicare and your supplement or Advantage plan. The supplement insurances, I think we've got those in there. There's a white copy, and it is like this. It's got some yellow on it. I know that these have changed. I know the amounts on here have changed. These are the 2025 amounts. But I'm not 100% sure what the 2026 are. So these are the types of supplement plans. So we have A, B, C, D, F, G, K, L, M, and N. So basically, there's the one that is on the F plan. If you were 65 before 2020, you can still get the F plan, but don't do it. It costs so much more, and you can get the G plan for much, much cheaper. The only difference is that Part B deductible, which will be $288 in 2026. So if you get the G plan, it's identical. You can't sell it at all from the F plan, but it's $288 for the deductible. Once you get that deductible, then your premiums are going to plummet. So it's really a good idea to, think about that G plan if you have, I've had a lot of people come in and their family says, I don't want to have an opinion. About 3 weeks ago, I'm paying $700 for the F plan, $700. And I know I can get the G plan a lot cheaper. It may not be cheap, it's a lot cheaper. So those are the supplemental plans right there. I'm not going to go into big, a lot of detail about them, except that if you do have an F plan, you might want to talk to your insurance agent about, to see if maybe a G plan would be a good alternative for you. Because again, once you put that, make the payments and pay up to $288, then you're done for the year, no zero. But the premiums are so much cheaper for a G plan than they are a F plan. My husband and I have F plan for I don't know how many years, and then we changed ours, and it just really almost half. So that's a Medicare supplement. The next page that we have in that folder is possible changes in 2026, right here. And that little emoji is one that I really felt yesterday.
Okay.
Right here. Oh my gosh, what are we doing here? In 2026. There are some real differences. It's the one with the little.
Carol, is the microphone on? I don't think.
Can you hear me?
There, that's better.
Okay, yeah.
Maybe pull it towards you some. Yeah.
Is that better?
That way.
Okay.
Would it be easier if you held it in your hand, or probably not, because you need.
I don't know if I can.
Okay, what page was it?
Okay, here's the one that says possible changes in 2026. Okay,
Just a second.
all right. I tried to have them in order, but when we were putting them together, some of them weren't quite in order. The changes in 2026, first of all, in 2025, there were 16 Medicare D plans. Do you have a full packet? Do you need another? Did you get it?
We found it.
Okay.
Yeah.
In 2025, there were 16 plans, Medicare D plans. And or 2025, there are 16. In 2026, 3 of those, actually 4 of them, but it's actually just 3, have been taken off the charts. In 2026, the premiums will be from $0 a month to $119.70 a month. And the deductibles will range from $130 to $615. This year, the standard deductible was $590. Next year, it's going to be $615. Does that mean you're going to pay more? Possibly, but if you get generics, probably not. So if you get generics, a lot of times you don't have to pay the deductible. So also if you have to get insulin, that doesn't go towards the deductible either. One Humana plan went from $20.90 in 2025 to 0 in 2026. The Medicare Advantage plans in 2025, there were 35 plans in Henderson County. In 2026, there's going to be 20. They're going to reduce those by 15. The premiums on those will range from 0 to $188 a month. And the various maximum out-of-pocket amounts will be anywhere from $4,500 to $10,000. And we're going to talk about that. Medicare B premiums, again, I mentioned this before, that they're going to $206.50. That would be altogether for Medicare B premiums. You're going to be paying $2,478 a year, your Part B. The income-related monthly adjustment, I'm not going to go into that because that's, if you have very, very high income, and I've got that chart with me, your Medicare premium could range from $295 to $600 a month, depending on how much. And that usually is impacted, that impacts people. A lot of times we'll see farmers come in that have paid maybe, saved their crops and paid it in 1 year, or sold them in 1 year. And they'll come in and think that Social Security made a mistake. And I'll think, you know, the good and the bad, you got all those to sell, but the bad is you got to pay more for your premiums. One thing I want to talk about that I think would be a big help, if not for you, if you know of anyone that would benefit from this and fit into this category, this is a godsend. This extra help through Social Security. If you are a one-person household and your income is $22,590 or less, or if you have 2 persons in your household and it's $30,600, then you'd be eligible for, you may be eligible for low-income subsidy or extra help if your resources also match what's on here. So your resources like bank accounts and anything liquid, monetarily liquidable. If you have 1 person in your home, it's $17,220. So bank accounts, savings, whatever. If you have 2 persons, you can have $34,360 as much as far as resources, and you'd be eligible for the extra help. And it makes a huge difference in how much you're going to be paying for prescriptions. It is unbelievable, and I'll show you that in just a minute. On the back side of that, there is this year, it was actually introduced last year, and it's called the Medicare Prescription Payment Plan. So if you have a high-cost drug like Eliquis, Januvia, some of those really high-cost drugs, then you're going to have a deductible to meet. That's $615 plus the copay of the medication. So a lot of people, that could be $900 in January that you would pay. So what Medicare has done is set up a payment plan, so you don't pay $1 to the pharmacy when you go pick up your first prescription. But you sign up for the payment plan, and they will take those payments and take them over a 12-month period, divide them up, and you'd be billed monthly. So it's, yes,
Are you billed to your house, or does it come out of something else?
you're billed.
You're billed.
Yep.
So if you miss a payment, what happens?
If you miss a payment, I think, as with most Medicare, they're forgiving one time.
Okay.
But twice, I think that would be not a good thing.
And can you set it up to be automatically deducted?
You know what, no, I don't think so, I think
Okay.
it is billed. In fact, the way that it happens is that you go in the pharmacy, what triggers it is if it's a $600 bill or over, that triggers that they're required to say, you're eligible for the Medicare D payment plan. And then they notify on their end the plan, and the plan in turn bills you. So, and that is if you have a $1,200. Now, here's where what I just told you about that low income subsidy on the other side, that extra help. If you have a brand name, instead of paying $500 or so that first month, you're gonna pay $12.15. So your brand names will come down to $12.15. Your generics will come down to not $4.90, it's $4.90. Sure, put it in there. They're so much cheaper. So if you qualify, and it doesn't hurt to just check to see, bring in your information, and we'll say, yeah, looks like you are, and the turnaround is really rapid. So if you qualify for it, we put in an application, and you'll probably, very well, you could be in it a month. But it has just helped so many people, and really they have increased that eligibility over the years to $22,590 is not a bad amount, and $30,600 for 2 people is a pretty good amount that you can have. And the resources, if it's 2 people, you can have $34,360 in bank accounts or whatever, and still be on extra help. So that's something you might want to look into. The other thing is the vaccines through the Medicare D must, the plans all have to cover all CDC recommended adult vaccines with a 0 cost sharing. And you'll see that, which your health department does provide some of that, so they'll know that. But those are some of the changes right there. Paperback. The next thing is that we're going to just talk about, because I have had a number of people come in and talk about their Medicare, mine and my husband's too. Medicare supplements have just gone through the roof. They're so expensive. They've gotten really, really expensive. What we've done is we call, I say, whomever you have as an insurance agent, just look around 3 or 4 agents and tell them your situation, see if you can get your plan cheaper. If your plan is a G plan, it's a G plan no matter what program you're in. So it can be, Aetna, it can be Progressive Life, it can be a lot of these different companies. A G plan cannot vary from the benefits. I've often said it's like getting a Hoover Elite vacuum cleaner. When I went shopping around, 4 different stores had 4 different costs. Same vacuum cleaner. That's the way it is with this Medicare supplement. If you get a G plan, it's a G plan, whether you go with this insurance agent or this insurance agent. And I've had some people come in and say, well, my insurance agent said, I can get this. And I said, here's what you can get. The definition of that G plan, that's it. That's it. No matter where you go, the same benefit. So you can't let anybody try to tell you my G plan's better or it's a higher rated. It might be a higher rated, but it's got the same benefits. And I did learn that some of the ratings on some of the supplements do not have to do with the beneficiary. It has to do with the payment back to the provider, which that's that. But it doesn't impact you. So those plans can be very, very, range in cost hundreds of dollars. Same benefit, same G plan, same F plan, same N plan.
So the G plan does cover pretty much everything?
The G plan, if you look on that, I'll show you, I'm glad you brought that up. On the G plan, if you got that, yes.
Okay.
What it does do is that $1,700 that's gonna go, up to the Part A deductible next year, you won't be paying it, your plan will be paying it. If you have a supplement, it doesn't matter if it's $1,600 or $1,700, the deductible for Part A, the hospital bill, you're not gonna be the one paying it. The plan's gonna pay it. So right there, you've almost saved your money if you go into the hospital. So, it's gonna take care of your Part A, coinsurance. So Medicare usually pays 80% of the approved amount, and you would pay the other 20%. In this case, the insurance company pays the other 20%. But not only do they do that, they have, on the Part B deductible, they pay, well, I'm gonna go down through the line. The Part A, they pay everything that Medicare doesn't pay. Part B, they pay the, Part B, they pay the co-insurance or the co-payment on, let's see, I'm going down. It talks about the blood, I don't go into that. Part A hospice, they talk about that. I'm going down to the Part A deductible, they pay the $1,526, this was a year ago. Now it will be $1,700. The Part B deductible, you can see that they don't pay that, you would be paying that, and that would be that $288. And then what's really nice is on the G plan, if you get the G plan, they pay 100% of the excess charge. So let's say a doctor charges you $120 for a visit, and Medicare says that they're going to pay 80% of the approved amount, but they only approve $100. So who's going to pay the amount between the $80 and $120? Your plan does. It pays the excess. So if a doctor charges you more than what Medicare approves, that G plan will pay the excess.
So I have lots of questions. So if you go in and talk to your insurance agent, and he's kind of saying, no, well, F plan worked good, it's up to you to choose which plan you want, correct?
I will tell you, and this is the gospel truth, the only difference between an F plan and a G plan is the Part B deductible.
Okay.
Once you pay, and in fact, I made a little sketch which didn't go over well. I couldn't even, my drawing's not good. But anyway, whereas a person, once they paid their, this was 2 years ago, I made it, this one of my packets. Once they did paid the Part B deductible, then they virtually were a Plan F person, beneficiary, because the exact same costs were for Plan F as Plan G once that G plan deductible is met. There's just, it's written into the rules. And no insurance agent can't vary or venture from that. So I have had in the past, not very many times, but have people come in and say, but my plan pays extra. They can't. These are regulated. I was at Strom in 1995 when these plans became confirmed and identified as the only plans that could be sold that were for Medicare, that would work with Medicare. The year before that, I had a lady that was absolutely destitute. And she asked me to come to, she lived just about 2 blocks from Strom Center. And she asked me to come to her home and help her figure out where she could save She had 7 insurance plans. 7. One of them was for a round-the-clock nurse that would never pay. The conditions were so stiff on that, it would never pay, and she was paying a huge amount. But she had 7, and it was the hardest task of my month to get her to relinquish those and go on a Medicare, just go on one plan. And that was right before the Medicare register, they identified me and say Teresa in. But we got that whittled down, talked to the insurance agent. Now, an insurance agent, it's illegal for an insurance agent to sign you up for a plan if you have an existing plan. You can only have one legally, only one. So if you have one, they can't sell you another one. And most insurance agents are very rigid about that. You know, they want you to sign your name that you have no other plan, or that by the end of that month, before the other one starts, that you're going to dispense with that. Because it's a legal matter at that point. So that doesn't happen anymore. So the Medicare Advantage plans, we are gonna talk about those, but that's a little bit about those supplemental plans. They're a great option, and there's something that if you want to put in the least amount of worry, that they are the best option, because you meet that deductible and then you're done. Yes.
Yeah, say I still have the F plan. You're saying if I would go to the G plan, the premiums will be cheaper
Yes.
a lot? I mean,
It depends on the company.
And what was the difference between F and G?
Okay, the F plan it pays everything, even the Part B deductible. The G plan pays everything, but does not pay the Part B deductible. So in 2026, the difference will be $288. The person that's on the F plan will pay nothing. Their bills will be paid in entirety. If Medicare approves them, they'll be paid entirely by the F plan. If a person has a G plan, once they pay $288, they will owe no more. It'll be like the F plan.
And it's cheaper per month to do the G plan.
There's, of course, every insurance company has, the insurance companies that they contract with. However, if you are talking about going to one company and checking their F plan against their G plan is going to be cheaper. That doesn't mean it's going to be cheaper than the F plan that some other company has. But the trick is to go to an insurance company, and I always say, when I sign anybody up for Medicare, I say, go to maybe 3 or 4 different insurance agents, tell them you're starting on Medicare, and that you want the G plan, and take the cheapest one, because they can sell you all they want, but it's not going to make any difference in the plans. If it's a G plan, it's a G plan, it's a G plan. So if they, they can, there's a huge range between different companies. That's why I say call 3 or 4 different companies and tell them, that you're interested in the G plan.
Okay, I'm going back to what you said about having to need 60 days in between hospitalizations. Okay, so if you have the G plan, okay, even if you have to have less than 60 days between, they're still going to pay, right? Because you have the supplement.
That's correct.
Okay, so just get a supplement.
Well, I will tell you, and I'm going to be really honest. I'm going to be transparent as I can. There's been a number of people, because in the last year, some of the premiums have gone up dramatically. However, I still say, even if they go up $150, let's say a month, $150 more than what you're paying now, which doesn't happen, but I'm using the extreme. Then consider if you didn't have it and you went in the hospital. I've said many times that anybody that knows my husband knows that he's awesome. He's a golden husband. Not only because he's a great guy, but because he had cancer and the bills were huge. I mean, the amount of money put into that guy is huge. And so he, at that time, they weren't pushing, they didn't actually have the G plan. That would have been in, let's see, it'd be 18 years ago. They didn't have the G plan. They weren't promoting the G plan, so they had the F plan. So he gets, and I've said this story so many times because it's just unbelievable, but he was at home with tubes and everything else in him. And we get this bill from Mayo's because we had been at Mayo's for quite a while. We get this bill, and I was working, I came home, and he was like, we got the bill. I said, okay, well, we just open it. And he says, no, he says, you open it. So I opened it, and I said, it was only $3.15. He said, only $315. I said, no, it's only $3.15. And he said, pay it. And I said, well, no, it was the F plan. So I said, no, I'm going to call and say, why do you charge us anything? It's the F plan. And he said, no, don't, just pay it. Just pay it. I said, I tell people they don't owe anything. I'm going to call. I called and talked to them at Mayo's, and they said, well, he didn't owe anything. I said, well, he got a bill for $3.15. She said, oh, that's always when the mail, crosses over, and the bill goes out before the Medicare or the insurance is paid. He had hundreds of thousands of dollars, I'm telling you. The F plan paid 100% of it. Had he had, in this day and age, the same cost, have the G plan, which he's got, he would be paying, we've gotten a bill for $288. And that's it. No matter what the cost was. No matter what the cost was. Here's the deal. Medicare supplements take after Medicare. They're the secondary payer. So they're going to pay what Medicare doesn't. But you have to make sure that Medicare, it's approved by Medicare, which we're going to get to that, and that's a biggie. So as long as they put in the bill, we've had people that have got huge bills, and I'll say, we just need to tell the provider to resubmit them. Sometimes the numbers have gotten mixed up or transposed. Sometimes it's just, but it's paid. If the Medicare pays, no question about it, your plan will pay. So that's something to remember. Now, there's a form, and I talked about these before, but I cannot stress them enough, and they're called the ABN forms, and you can see it. There's one in your packet. There's a write-up about it. I'm not going to belabor that, but this is, you cannot imagine how important this is. You cannot imagine how important this is. This is makes the difference between whether a bill is going to get paid or not. It's called the Advanced Beneficiary Notice. So, if you go to the doctor and they want to provide a procedure for you, or perform a procedure on you, and they have you sign one of these ABNs, that means if Medicare doesn't pay, you will pay. And usually it is something like, if I had a mole taken off, and the doctor thought, oh, it looked a little bit suspicious, then they may have you sign one of these for that, because the insurance may construe that as cosmetic instead of medical. So they have to make sure that they're billing those correctly. But in order to cover themselves, they will have you sign one of these. Very rarely will they have you sign this. Usually the doctors are very well of what Medicare is going to pay, and so they will put in what Medicare is going to pay. So the ABN is, if Medicare doesn't pay for the procedure, they'll mention the procedure, and they have to be the ones to fill this out. And it will list the procedures, and then it will say on here the estimated cost of that procedure. They have to put that down there, so that if you are liable for it, that they're not going to stick you for a really heavy cost, when actually they put a certain amount here. It can't vary a lot from that. But this, if somebody wants you to, and I get bolder in my age that, I'll ask them, was one of those ADN? And usually they say no. However, the rule is from Medicare that they're supposed to sit down and explain this is an ADN. But a lot of times they just stick the things in front of you and say, sign here, sign here, sign here. Make sure you know what you're signing. And especially if it's something that could be construed as cosmetic. Another one is I had a lady, and I know I told this many times before because it was the most extreme misrepresentation, actually. I had a lady that had back was hurting her, and so she needed to have breast reduction. And she got a bill for it, didn't bring it in. Finally, she brought it in, and I said, well, did you sign that you would pay for it if it didn't go through? And she said, I didn't sign anything. So we called the hospital and said she didn't sign any form, but she's getting a bill for it. And they said they'd call me back. They called me back, and they said, do you want us to send you the form that she signed? So she had signed. So she was liable for it, and it was too late to appeal it. So she had a really huge, we went through a lot with that one. There was some negotiating to take place, but really, you have to know what you're signing. So, but that's the ADN. That's the ADN. So that's something just to, I usually give out because at least once or twice a year I get somebody that brings in a bill and they say they haven't signed it and they haven't. And so we can say, hey, you need to just submit that bill because they're not, if they didn't sign this, they're not going to be on the responsible for it. The provider is. So, okay, the other thing we're going to talk about quickly is Medicare Advantage plans. And as I said, those have been reduced. So if you're in a Medicare Advantage plan that you signed up for this current year, the chances are that it may not be available next year. And that means that you're going to have to, if you want to stick with an Advantage plan, that you're going to have to sign up for during that open enrollment period. The Advantage plans are really they can be very tricky. When I was here last year, I think I mentioned that my twin sister, identical twin sister, she was diagnosed with stage 4 lung cancer. And she had an Advantage plan. Every year I say, Kathy, she'd say, you're paying all these premiums and I'm not paying anything and I'm getting coverage. And I said, Kathy, you haven't gone to the hospital yet. Well, she had a coughing spell and went to the doctor, found out that she had stage 4 lung cancer and she was on an Advantage plan. It was really devastating, obviously extremely devastating. And that's why don't smoke. She smoked and I didn't. Don't smoke. Anyway, she wanted, through her Advantage plan, she was assigned a doctor because you have to go in the network that your Advantage plan requires. So she went to the doctor, and the oncologist she really wanted was not in her network. She's a very spirit-filled person, very devout Christian, and she just said, I'm just going to put it in God's hand. What happened was the doctor that was in her network wrote a letter and said she had too many patients, she couldn't take her. Because of that, Kathy got to pick her oncologist. And he was wonderful. He was wonderful. He tried some very experimental things with her. However, when she first went in, he wanted to do a scan. And because of her being on a Medicare Advantage plan, she had to have it approved. They knew that she had cancer, they didn't know what stage. And she had to wait 2 weeks to get that scan. If she had had a Medicare supplement, she could have had it the next day. So of course the doctor was very, very upset. I mean, he said, time's of the essence.
Yes.
And And she eventually got the scan, but this doctor really pretty much was instrumental in saving her life. So she's right now at a plateau. I can't say it's remission, but it's not active, is what they say. But because she changed from that Medicare Advantage plan, she's legally blind. She could go to Iowa City, which she couldn't before, and have a cornea transplant.
Oh, wow.
And she can't see like I can see, but she can see better. Those are things she couldn't do on Advantage plan that she could do on with a Medicare supplement. She's just having fun going to every doctor outside her, county. She can make appointments anywhere and she can go. She doesn't have to have a referral. Yeah.
So who recommends the Advantage plan? Because we have friends that they had ended up going to the emergency room twice within the last few months, and then they get this horrendous bill.
Well, I will tell you that the worry to me is if you look at, there's a lot of the Advantage plans, you look at it, and you may see that there's 3 different kinds. There's an HMO, you have to stay in network. There's a PPO that you don't have to stay in network. You can go to other doctors and it will pay, but not as well. Then you have what's called an HMO POS, which is an HMO point of sale. That HMO point of sale, you have to stay in network, but you can get permission, and it may be approved to go out of network. Where if it's strictly an HMO, no, you have to stay in network. But with an HMO POS, there's some wiggle room. With an HMO, with a PPO, you can go out of network. There's a network, you can go out of it, but you'll pay more for those doctors that are out of network. That's not good. So basically, what she had was an HMO. And so, when that was, when we were getting all this information, of course, when anybody is diagnosed with anything, I say, what kind of insurance they have? Because that is very critical. It can really make you feel comfortable and think of your health instead of being concerned about the cost.
Okay, you said she had cornea transplant. I thought Medicare wouldn't pay for anything that was vision.
Oh, yes, it will.
Okay, explain that
Yes,
one. Okay.
So Medicare will pay for vision if it's medically based. If you go to an eye doctor for an eye exam, it's not medically based. But if you go because you have glaucoma, macular degeneration, cataract surgery, blah, 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 anything medically based,
Okay.
then it's going to be covered.
Okay, just not eyeglasses.
Exactly.
Okay.
Yeah.
All right.
And there are some conditions they do on that. If you have cataract surgery, there's some little nuances there. But basically, Medicare will pay, definitely pay for that surgery.
Okay. Another question.
Sure.
I got so many people that ask me things too. Okay, say Burlington Hospital all of a sudden wouldn't take Advantage plan.
Right.
Okay.
Right.
And there was a lot of people that already had Advantage plan, and they needed to change over because of that. Can you change over from Advantage plan to Medicare because your local providers won't accept it anymore?
There are some exceptions, and you really have to notify that plan. There are, like when my sister had cancer and she was diagnosed, she had Advantage plan, and by the time she was diagnosed and we knew what stage, she could have gotten out of that because there are some critical issues. If you have critical instances, you can try to appeal and go with Medicare, original Medicare, a supplement, and a Medicare D plan. However, the process takes a while, so it's not like overnight. And you have to make sure that Medicare supplement is going to take you.
Right.
So if you can do it during open enrollment, just enroll in it. If you enroll in a Medicare D plan, it gets you out of the Advantage plan. It takes you out automatically. Because you can't have 2 plans at once.
Right.
So if you do that, it overrides it, and the one that you have the latest is the one you're going to be in. And then you get you're back to Medicare, original Medicare, and then you get an supplement from your insurance agent.
Okay. another comment, of course. My father-in-law, just for example, because this happened to us, he ended up in an emergency situation, and I had talked to him I was blue in the face, do not get Medicare Advantage, do not.
Yeah.
I thought I had him convinced, of course he took Medicare Advantage, also probably just to be stubborn. And so when it came time for him to be in the hospital, because he had to have an amputation, okay, he ended up in Galesburg and Peoria, which was fine, but usually it's closer to go this way. Then I tried to get him, at that time I didn't know that he was stubborn and didn't do what I asked him to do. And I was trying to get him set up for home health care from here.
Sure.
Well, we couldn't take any of that at the health department because they wouldn't pay us the right amount, you know, a good amount. Okay, then he ended up in the nursing home. Oakwood and Oak Lane won't take it.
They won't, because they're neither Advantage plans or Medicare supplements pay for a nursing home, except for those Part A days. So if you have surgery or something, then you have to go to the nursing home, a skilled, not an intermediate or an assisted.
Okay.
But you go to a skilled, then you have those days available to you up to a certain amount that they'll pay, but only a certain amount. It's not for residency, it's for recovery and recuperation.
Okay, so he was in the hospital about 10 days.
That would
So they should have taken him, because strong nurse is a skilled,
if they're skilled,
they're skilled.
and his condition warranted skilled nurses. He could be very sick and just be eligible for intermediate, and that wouldn't pay.
Okay.
So it's by the Medicare guidelines.
Okay.
They stipulate what constitutes a skilled day.
Got it, okay.
He might be in skilled, but it's not skilled, you know, he may not get skilled coverage. It's definitely up to what Medicare guidelines say, so.
And the closest we could get him to home was Galesburg. So people keep that in mind when you're looking, ask your area what is.
And a lot of people do think that, you know, they're under the impression that, you know, that there are skilled, that they can go to a nursing home and their Medicare supplement or Advantage plan. Never do they. It's always just after some type of catastrophic illness, you know, a broken leg, whatever, then it's for recovery. So, yeah, so those are, but those are built in even whether it's a supplement or an Advantage plan. The problem, and I'm not saying the problem, the situation with the Advantage plan is, again, wherever you go, it has to be a network. So I do the bill paying for a disabled, he's not young anymore, we both grew old, but I pay his bills for him, and he wants to do things on his own. And so he needed to make an appointment out at OSF for medical reasons. And I said, remember, I wrote down, remember to ask them that you say that you have to be a network. Everything was fine, his bills came out, it was an Advantage plan, everything came in, everything looked fine. Then we get a $900 bill for lab work that was sent to Peoria. It was not a network. So his doctors and hospitals, I should have said, your lab, your doctor, a hospital, that's awful. Yeah, but that went to Peoria. So he was on the hook for that. Had he been with a supplement, he wouldn't have had a bill. So, not that I'm trying to push supplements, but I've had people that have said, you know, my supplement is going up sky high, it's going through the roof, I can't afford it, and so I'm gonna go, what do you have for Advantage plans? And we have to, I mean, Erica knows that, we can't make the decision. If they want an Advantage plan, and after we give them all the ins and outs, they still want that Advantage plan, that's their choice. And so, I always say, you know, give me the 3 to 4 doctors that there's no wiggle room, you need to have those doctors, and the hospital that you wanna go to if something happens. And once we put in the plan those things and let it filter through and see which plan is the best, and their medicine, because the medicine's embedded into it too, then we can come up with a plan that might be a 0 premium. But I've got plans here that I'm gonna be sharing with you that the maximum out of pocket can be anywhere from 4,000 to 10,000. What does that mean? It means if you go in the hospital for 5 days, each night, it could be like $500. So that's 5 times 5, $2,500. That goes to the maximum out of pocket. You go to see a doctor and you have to pay $30 out of pocket. That goes to your maximum out of pocket. Once that maximum out of pocket reaches 4,000, you don't owe any more as long as you stay in network. But it can go to 10,000. So you're leaving yourself open to $10,000 in copays before you get a zero. So if you take a supplement, again, I'm not paid by any supplemental companies, and I don't sell them. But take that, and I did a workshop on this 1 year. I take all of these things, and I say, here is what you paid out for premiums, what you paid out for a deductible for a supplement. And then here's your copays if you had a heart attack, if you had cancer, if you didn't have anything, and you were well. Here's your end results. Now, if we could look back instead of, and we could say, yeah, well, I'll take that one. But we don't know what's going to happen. My sister, that would have been the last thing on her agenda, is to be diagnosed. So it's really, there's so many things that if you're going to be an Advantage plan, and she was a retired teacher, by the way. My twins were. So I was a teacher too, but I didn't care for it. One for me. But anyway, she's a retired teacher, and she never did get into the teacher's plan. She wasn't eligible for that. But she did her homework. She's legally blind, but I'll tell you, she didn't have central vision, but she had that peripheral vision pretty well defined. And so she knew where every penny went. She knew where every penny, she knew what she was doing, but she didn't count on getting cancer. That's the problem. She put away money for, in fact, she was saying how much she paid or saved for supplement. She put what she would have been paying for supplement aside in case she had an illness. The years that she put it away wouldn't even be a drop in the hat. So she's very conscientious. She's the kind of person that should get it, but you can't get cancer or have catastrophic illness and be really, have everything covered. So yeah, that's it. Those are situations that you have to really watch out for. So the Advantage plans, I think I have something in here. Supplement. Okay, I do. It's got there's a paper here, and it's got medication, Eliquis on the top. You see that? Okay, this, as I said, your Medicare Advantage plans have nearly all of them, but one or two, have the prescription drugs embedded into them. Did everybody find that? Okay. All right, so they have, so I put one drug in. I put one drug, and that's Eliquis. Did you find? Okay. And I put Eliquis in. And then I looked at different plans to see how much the drug part of that plan, how much they would be paying for Eliquis, how much they'd be if they were on an Advantage plan. So the first one I look at is a PPO, and again, that is a plan that you can go outside your network, but you're going to pay more if you go outside your network. But you can see the drug cost for that Eliquis for the year would be $1,300. And that's with the Humana Choice plan. There's an $18 premium a month. Then the next one is called Humana Choice. And the premium for that one, now it's on the next page, that would be $103 a month for the premium. Your total cost for the drug would be $2,300. And I'm going to quiz you on something in just a minute. The next one's Aetna Advantra Extra. There's no premium on that. The drug cost would be $1,183 for the year. The next one is Blue Cross Medicare Advantage, and that's an HMO. Remember that HMO, you have to stay on network, even for your pharmacy. And that would be $921 a year for your drugs. And then you've got the AARP Medicare Advantage from UHC, United Healthcare. That one is a HMO POS, HMO point of sale. So they have to stay in network, but if they get permission, they can go out of network. That's what that point of sale is. Their premium is $45 a month. They'll be paying $1,455. And then again, on the back of that, it just reminds you what point of sale is. Now, I'm gonna have you go back to page 1 and look at the out-of-network costs. So if you go to Humana Choice, it's a PPO. But they're saying they're in and out of network. You can go in network, stay in your network, and go out of network. But you have the possibility of having to pay $10,100 in copays before it zeroes out. On the next one is Humana Choice, and that's $13,900. That's a PPO. There you have the possibility of paying $13,900. The Aetna Medicare Advantage on the next one's a PPO, $10,100. The next one is Blue Cross Medicare Advantage, and out of the maximum may be $4,000 if you stay in that network. So that's the cheapest, however. And then the AARP Medicare Advantage from United Healthcare, again, is $4,900, maximum out of pocket that you'd have to pay if you stayed in network. Here's the deal with my sister. She was on Welfare Essential. The maximum out of pocket was $3,200 for the year. But we think that's great. By the end of the year, because she didn't have anybody in network and it was an HML, not a POS, she paid $6,700. So, it's a little bit scary. But I had a lady that was at one of my meetings and she said, these Medicare supplements have gotten to be so much, I just don't know, I feel like I'm gonna drop it, what do you think? And here was my reply to her. Here's my progression of the best to the least. Medicare and a supplement, Medicare and Advantage plan, and then Medicare original alone. At least with an Advantage plan, even though they say, it's $10,000 out of pocket, and it may be a little bit more, it's better than my husband going to Mayo's and us losing everything. $200,000 is the 20%. So there's the progression, the best to the least, Medicare with a supplement, Medicare with an Advantage plan, and Medicare original. So, again, some people, the medications on some of the Advantage plans in the past have been what sold them, but now, when we talk about these changes, the one figure I want you to write at the top of that page is $2,100. $2,100. Because when you pay $2,100 in medications, you owe $0. If those medications are on your formulary. And that's true with the Advantage, and that's true with the Medicare supplement, or Medicare D. Once you pay $2,100, the rule is that you owe $0. So if you have a high-cost drug and it's like, $500 a month, then you're going to pay less than that because you're going to be on a Medicare D plan. But every time you pay for that medication, you add it up. If you had a little calculator and added it up, if you ever reach $2,100, that's $0. And we have people that are on that would get $2,100 like March, wouldn't they? So, we have people that their drugs are so high that they would pay that amount out, and then by March, they don't owe anything the rest of the year. So, We're just gonna talk a little bit, and I got some printouts for, and then I got a couple extra things besides that. Here's the printouts for the Medicare D plans. There's two of them. Two charts. And one thing that, on the bottom of this one, it has a little bit bigger print. This is where I sit down, you know, I don't read novels, I like reading Medicare. I always said my son, he actually couldn't become a doctor, he would take, you know, chemistry was or something in the bathroom. Not me, I take Medicare. I'm very interested in what the latest is. But here's the what I printed out the other day. Here are the plans that are available both in Henderson County and Warren County in 2026. And if you look at the bottom, there's Blue Cross and Blue Shield of Illinois, Cigna Extra, and WellCare Medicare RX Value. If you are on one of those plans this year and you don't review, Medicare will put you in a plan that you can't escape from. There was 1 year that they did there was a plan, I think it was the first health card D. Anyway, it was, I think it was like $15, the premium. And it went off the charts. And so Medicare, if you didn't change it, you didn't change it, Medicare changed it, and it went to like $39. The highest one was a $70 difference in the last few years that I've been there, that I've been doing this. So the main thing is, and I had a meeting just the other day, and actually I was kind of scary, it was with another center director, and last year we did save, and Erica was part of this, God bless her. She, and of course everybody said, Erica smiled. But anyway, she, all of us together, she and 4 of us over, you know, that are at Strom, at the Strom site, the same people between Henderson County and Warren County, $1,245,000. $1,245,000 from changing people from one plan that they had 1 year that worked great for them, but the next year we'd look at it and it was horrible. So the reason is the plans can, from 1 year to the other, they can change their premium, they can change their deductible, and they can change their formulary. And the worst of the worst is changing the formulary. So my classic example of this is that the man that I had about 2 days before the end of Medicare D. I give this example all the time because it's one of the more extreme, although not, because we have even more extreme ones that's happened since then. But he came in and he said, I want you to look at mine. He didn't even have an appointment. He said, I just want you to check on it. And I said, okay. And I looked at his, and it did make a difference. And so he said, yeah, I'll change it. But he said, my wife said before I left the house, do not, under any circumstance, change my plan. Don't change it. I love it. It's working great. Don't mess with it. And I said, well, let me just look at it. And he said, don't even. And I said, let me just look at it. Let's look at it. Looking at it, if she just stayed on that plan, the next year it would cost her $23,000. And so I said, here it is. And I turned my monitor around and I said, here. And he said, what? I said, this is what she'd pay if she stayed on the plan she's on. This is what we can get her on. And he said, change her. And I said, don't you want to call her? No, don't call her, just change her. So, but it was $23,000. The reason being, she's a very ill lady. She'd been chronically ill. She had 4 or 5 tier 5 drugs that plan was no longer going to cover the next year. They weren't going to. They were going to cover either generics or substitutes, but not the tier 5. And so that stayed down. I mean, we talked about that for years afterwards. But anyway, so that's where the savings come in. But the lady that was at a meeting I was at the other day, she said, I don't know, she said, I was telling her, you know, we have pretty long hours during Medicare D, and she said, I don't know why, if they're happy with it, why just tell them to stay in it? And I thought, oh my gosh. Oh my.
Wow.
I mean, I'm just,
That's lazy.
it's not good. And it's not good because I'm thinking of all the persons in that county who are getting shortchanged, and they are probably they could be having financial trouble, and this would have been, an answer for them. So.
You know, when you were saying that the Medicare D works good for Warren and Henderson County, you were talking about a while ago, a lot of us go over there. Okay, it's gonna be based on our address
The residents.
of your residence, gotcha. Okay, I wanted to make sure.
I have to say, the providers, wherever your providers are, there might be providers that we put into that whole scheme of things, and they'll accept the plan. They don't have to be where your residents are. In fact, when we're in rural counties, we're gonna be
we don't have any.
St. Francis or
Yeah.
Burlington or whatever. But it's important to put those in. And just so we know, but no, it's definitely, in fact, there's someone in this county that I did her Medicare D, really sweet lady, just love her, she's really, really sweet. And we figured out a Medicare Advantage plan, and so she's somewhat happy with it. And then she called me, I was always up at o'clock on Friday events, and she called me and she said, I really appreciate your help and everything, but she said I had somebody sign me up for a different plan. And I said, well, that's great. I wonder how I missed that one. And so I got in my materials, and that plan was not for people in Henderson County. And I called her and I said, would be a really good plan if you were in Warren County, but you're not. You're in Henderson County. And it won't fly, you won't. And she said, well, I don't know, such and such, what? And I said, well, can you give me his number? So I called him and I said, he was quite irate. And I said, do you realize that she's in Henderson County? Yeah. He said, it's in that county. And I said, no, it's not. It's not. So had she stayed with that, she couldn't change. I mean, she could change, but it would be another month before so none of her bills for 1 month would have been paid, none, because they would have denied those claims. And so I said, I won't argue the point, but just really check into it. And he called me, he says, I got 5 people in Henderson County, and I said, I really appreciate it. He says, what happens is you get people in plans like AERP, Safer. You get AERP this, AERP that. There could be 3 different plans, AERP, United Healthcare, but maybe one of them is good for Henderson County, but it's not good for Warren County, vice versa. So you have to really be up on what's in which county. Because it is, like you said, it's a county of residents that they go by. So, yeah. So when you do the Medicare Advantage plan, you definitely have to put the medicine into it. You can't divide it up. You can't have a Medicare supplement for your health and then a Medicare Advantage plan for your medicine and so forth. It's all or nothing in each one of them. So the other thing that on these plans, as you can see here, I've got you don't need to be bothered with that plan ID, but here's the names of the plans, and here's the 2026 premiums. And what I did is I looked back to see what 2025 premiums were, and then I showed the difference. So in 2026, if you go with AERP Medicare RX Walgreens plan, you have to go to Walgreens for that medicine. The premium is going to be $103.90. The premium last year was $81.10, so it's going to be $22.80 more out of your pocket. If you go with the AERP Saver Plus plan, it's going to be $40.20. Last year it was this current year is $42.20, so you're saving $2. So you can kind of go down through those plans. The Health Spring Extra and Health Spring Assurance, we can't compare those because they're not available this year, but they will be next year. So you can see on these, there's a range of deductibles too. If you're going to be taking, and the only reason you'd be taking AERP RX Walgreens if you had a really high cost brand name drug. Otherwise, you'd be taking a different plan. But the premium is $103, but the nice thing is the deductible is $130, so you're not gonna have to meet a high deductible. So the deductibles are all there too. And then there's this plan, which is quite small, the writing, but when I said on this, I'm gonna go back to this one, where it talks about the low income, or the extra help at the bottom of the page. If you look at that, and then look at this, some of these plans cater to those plans, those people that have extra help. So basically, on some of these, if you purchase one of these plans, it will reduce your premium quite a bit if you have the extra help. And it shows down there, well, it says the premium with the extra help. So on, a Medicare plan, which is a silver script, it's silver script choice, you'd be paying $94.90, but if you have extra help, it only costs you $79.70. So if you had, so you can go down there, it's just really a neat look, concept that, they're gonna not only reduce the cost of your meds, but they're gonna reduce the cost of your premium for many plans, as well as you will not have a deductible. So instead of some of those high deductibles, you won't have a deductible if you're on extra help. That's why I tell people, even if you're just really close, it is a gross amount that you have to put in for the extra help. But oh my gosh, if you qualify for it, it can make a huge difference. So it's just really a lifesaver for a lot of people.
Again, when you were talking about the extra help, is it your liquid assets, or does it count for your house?
It's gross. It's the gross out, so it's your Social Security, adding back your 185 if you have to pay, well, be more next year, 206. But the gross amount of your Social Security, if you have, and then as far as the resources, it's what you have that's liquidable. So your bank account, your CD, your savings account, whatever.
Or if you have a 401k.
Yes, that would be. And that's something that they look at twice, because some of those pension plans, they will take the amount you have in that plan, but some of them, if you get regular payments, they will take that as the income you have each month. So it depends on which way you go.
Okay.
So, yeah. So, but if you know of anybody that, is struggling a little bit financially, and you know that their income would get somewhere in that, oh, please let them know, because that is, it's great. It's great.
And to do that extra plan, the
Extra help?
extra help, we bring it to you to figure that
Yeah,
out?
you just make an appointment, bring in the information.
Bring in the information, okay.
That is one that you don't have to, you definitely want to be, I always tell everybody, I'm not the one signing the application, you are, so make sure that you're, I don't ever accuse anybody of not, but sometimes you forget, oh, I do have, in fact, I have a lady that, her husband just passed away, and we were talking about her income, and she said, and I said, well, didn't he have a pension? She said, did he? Because he always was it came in, and so we looked, and yeah, he did, but, you do to the best of your ability, you put in what you have. But it can be a lifesaver. You don't have to count your, as resources, your home, your car, anything like that, anything tangible like that.
And the application takes like 10 minutes to do.
Yeah, it is so
So
fast.
You have to do what?
The application that we will do for you, it takes maybe 10 minutes to complete.
It's very.
What if you bring just your tax paper?
Yes, that would be the best.
Now,
There's some things like the VA application, you have to actually bring paperwork in. But this is, as long as you write it down, you have it, pretty well established what then you can.
Yeah, we don't have to take any type of documentation to submit it as long as you know
But if
your
you
gross
bring it,
amount.
it's easier for you, too.
Yeah.
What's true and what isn't.
and that's available nationally, or just?
Absolutely, it
Okay.
is a national,
Yeah.
and it's available all during the year. There's some of these things that have time frames, but that's not one of them. What is one of them is the Advantage plans, and the Medicare D plans, and Medicare enrollment, things like that. So, So, yeah, there, what I have there, I don't know if anybody here, if anybody here is on insulin, I'll tell you, last year, one of the best things that happened was last year, if anybody is diabetic and on insulin, you're well aware that insulin was reduced to $35 a prescription. So, which is really great. That's great. So it doesn't matter if you take 10 vials of insulin, or 1 vial, or 1 pen, or 20 pens. It's going to, if the doctor ordered so much a month, then that is $35. So they did add Novolog to this. So that's a really plus. But on here, a lot of people, and I put in a drug list, and obviously that second page, nobody's going to take these drugs. I've got Humalog, Humulin, Novolin, and Novolog being prescribed. And obviously nobody's going to be taking all 4 of those, but I put them in to show what the costs were. So that's the drug list right there. On the next page, it shows how much each would be per month. I'm sorry, yeah, the retail cost and the amount per month. So the Humalog Quick Pen, and I didn't even put the numbers in here, but it'd be $35. The retail cost would be $542, but you only pay $35. And that doesn't go towards your deductible. But I mean, $35 is awesome. And it says cost before the deductible, cost after the deductible. Well, there is no deductible, so the same, it's before and after. The Humulin is $47.22. That's the retail cost. It's $9.44. So insulin's $35 a month, but it says here it's $9.44. So what happens is if it's $35, if it's more than $35, it's $35. If it's less than $35, it's the cost that's charged. So they're not going to make you pay $35. It normally is $47. Novolin is normally $282.52, and it's going to be $35. The Novolog, $557, one of the more expensive ones, $35. So basically, if you took all 4, which you're not going to, it'd be $1,400. Altogether, but you're not. You're going to take that. But it's just to go to show you how much difference there is in the insulins, and I know that there's different reasons for them to be different. But no matter how much it costs, it's going to be $35 or under. So, and the other thing that I get asked, I mean, during Medicare D particularly, is who covers the Medicare, the diabetic supplies. So the diabetic meters and the testing supplies, you need to look on your Medicare D plan to see what's covered, and you can ask. The blood glucose meters, it shows there. You get a quantity limit of 1 kit for every year. And then the test strips, it tells you the quantity limit of 4 strips a day and like 100 strips for a 25-day period on all of those. The One Touch Ultra, the One Touch Verlo, all of those. Those are the test strips. And then the Dexcom, you would go through Part B if you want to get the Dexcom, where it's the digital reader. So in the Freestyle Libre, a lot of those are covered under B, but a lot of your test strips and so forth are covered under your Part D. So it gives you a little bit more information on the back of that. So the only other thing that I really want to say, and this is something that I mention every year wherever I go, well, 2 things. One of them are generics always the way to go, and people automatically think that generics are the way to go. And I put down here 2 drugs that I put in a plan. One's Xarelto. The brand name for that one is Roiva Roxaban, and the other one's Lipitor, and the brand name's atorvastatin. And I put those on a plan, I put them on the Humana value plan, and you can see it when you look down through there. And let me see here, on like the last page, where you can see I circled it. That, the Lipitor on this particular plan isn't even covered. The atorvastatin is, but the, generic Xarelto is actually cheaper than, the generic is cheaper, Xarelto, in some cases, is cheaper than the generic. So you can't always tell which, when you do when we do the Medicare D for you, it will give us the option of looking at all the generics, and it will tell you whether that generic is cheaper or the brand name's cheaper. It's not a set in stone thing where the generic is always cheaper. It just isn't, especially on certain plans. So that's something to think about too. So be kind of open when you, and the yellow sheets, if anybody's seen the yellow sheets, it says on that last column on the yellow sheets, there's two things that you need to be aware of. One thing, if I did somebody's drugs, I think it was levothyroxine, and we put in a capsule, it was $1,000 a month. And the tablet was $0. So make sure that you put down whether you're taking a tablet or a capsule. Most generally, Medicare is not going to pay for capsules. Most of the time, I would say, they're not going to pay for capsules. There's some things that just come in capsule form, so that's an exception, but if there's a choice between a capsule and a tablet, almost every time Medicare will pay for the tablet. So that's something to keep in mind. The other thing that I have run into personally, not me, but somebody in my family, and that is, I'm going to mention this, to make sure that if you go to the hospital, you know whether you've been admitted or whether you are an outpatient being monitored. Because if you're admitted and you have a supplement, everything's covered. If you're an outpatient, you're going to have to pay for your medicine, and you may pay for extras. So make sure that if you go to the hospital, it doesn't matter if they put you in a bed for 1 day or 2 days. Ask them, have I been admitted? I had a family member that fell, and he was put in the hospital. They immediately had him in a room. And so I asked the nurse, I said, is he admitted? And she said, well, he's in there. Yeah, he's already in his room. And I said, no, I'm asking you, is he admitted or is he an outpatient being monitored in the hospital? She said, I don't know. So she went and asked, and I said, and can I get it in writing? And so we did, and he was admitted. But it's really critical that you know, because my one-time story is I had a lady that was in the hospital, and she was in there for a couple of days. Anyway, she brought in a bill for medication, and I said, well, you were in the hospital, weren't you? And she said, yeah, I was. So I called, and they said that she wasn't admitted. She was under observation. So her medicine was charged to her. She had to pay for it.
Used to they let you, if you're going to be observation, let you bring your medicine with you, or send your family home to get it. And recently I tried that. It's changed. They won't let you do it anymore.
Well, they will let you have a pharmacy deliver it. But it can't come from you. It has to be in that dispensed.
Okay.
If they let you, it'll only be that way.
Okay, that's good to know because, yeah.
Yeah, because if you look, if we did your Medicare D, we would look at the OSF pharmacy. So, sometimes it's not the best. It wouldn't be the best for the plan you're in.
Right.
So are there any other questions?
If they're waiting for a bed for you and holding you in the emergency room for 2 or 3 days, basically, you're not admitted, right?
No, it goes by Medicare guidelines.
Okay.
So they're the only ones that can tell you. A doctor has to say the only way that you can get, is you're going to be admitted. But you have to ask point blank. I didn't fault this gal that I talked to, but she said, well, he's in the bed.
Yeah.
I said, yeah, but So you have to really.
That's good to know, because I would assume like
Well,
in a room and in a bed.
And I ask for, anymore, I'm asking for everything in writing, so I know, and you know what you're doing, and everything. I just get it in writing. And that's why, if I'm emailing, a provider, which I've done before, it's great to have an email, and you got it in writing. So, yeah. Okay, anything else?
Wow. Thank you very much. It's a lot.
Yeah, I'm planning on coming to the 1 o'clock again too, so I'm sorry, I'll probably ask the same questions again.
Wonderful. Yeah, that's wonderful. Yeah, and if you, Erica she's got some yellow sheets, so if anybody wants to see her, we're not assigning her, we're not scheduling her, she's gonna do that on her, we're doing, but, whatever it's convenient.
Yep, nope. I'm gonna take on some clients, so if there's anybody that wants me to review your, Medicare D plans, just let me know, give me your yellow sheet, I'll take those on, and then after enrollment, then I'll pass it, I'll go out to Carol to, put it in for record keeping, so that way Carol will have all your information. But yeah, if anybody has any questions, or any viewers has any questions, please get a hold of Carol, or any of the staff at Strom, or
We
even
miss
call in.
Erica, she did an awesome job. We miss her. I'm speaking to her, but just Caroline.
But she does an awesome job here too.
I'm sure she does.
Thank you, everyone.
She wears many hats.
Yes, she does.
Well, thank you.
Thank you.